Since 1992, ESWI, or the European Scientific Working Group on Influenza, has been a true network of influenza stakeholders that's grown into a loyal organisation with a clear and unique position in the European influenza field. Until today, ESWI's partners share a common ground, the social concern to improve public health in Europe by reducing the number of influenza victims. Annually occurring influenza is an important public health problem in Europe. Influenza vaccination, among other measures, is one of the primary means of reducing the burden of disease and transmission of influenza. Although influenza vaccines have proven to be safe and efficient, influenza vaccination in Europe is largely restricted to people in high-risk groups. People assumed to be at the highest risk from influenza. But a significant proportion of the current risk groups is not being vaccinated.
Vaccination is also being used to provide protection well beyond the childhood years.
When it comes to flu, people are confronted with different opinions by different stakeholders. It's in this multitude of information that people need to be able to step away from erroneous views and be able to track down the right information on the influenza issue. People need to see how the influenza story is a positive one and a constructive one. They have the right to know how this information is spread and by whom, in order to obtain an individual and objective decision-making process when it comes to influenza vaccination. Therefore, expanding the variety of messengers spreading the right message on influenza is important to raise influenza awareness among those people at risk who have not yet decided to be vaccinated. ESWI's scientific expertise is translated towards both public health experts and healthcare workers. Close collaboration between influenza stakeholders, like public health officials and healthcare providers, patient organizations and scientific institutions, have built transparent networks in different European countries, which share their strategy to fight the burden of influenza. Those networks support and strengthen the national public health activities of each specific country by spreading clear messages and helping to build dialogue between research institutes, government and general practitioners.
From our experience with working with countries on seasonal influenza and also during the pandemic, we know that as public health officials, we can't tackle influenza alone. So we need to work together with all relevant stakeholders. Stakeholder networks should include associations of general practitioners, other medical professional associations, pharmacists, patient group representatives, scientists, public health officials, and other Ministry of Health officials. Such stakeholder networks are important reference points for policymakers and for WHO.
In-depth communication activities targeted to these country influenza stakeholder networks underline the impact of seasonal influenza and the potentially worldwide outbreak of the influenza virus, named a pandemic. Turkey is a vast country in which ESWI, scientists, public health officials and healthcare workers are creating an influenza stakeholders network that's determined to move things forward in the fight against influenza. The first ESWI influenza stakeholders meeting was held in Istanbul in 2011, bringing together the core group of healthcare providers, patient organizations, public health officials and different medical professions during the launch of the Turkish GRIP Platformu.
Influenza is an important disease that has a great burden in the public, and after the pandemic we know that it's a great number of deaths. Any kind of disease that affects the public every year, every season. Turkey is a populated country with more than 72 million people, so that's why we are in this platform.
Well, on behalf of a lot of family physicians, this platform is very important because, first of all, it's the first one in Turkey, and at the first time, a lot of different specialties are getting together. First of all, we need a lot of research. We have to see the picture of Turkey about the flu vaccine and also the disease itself.
On behalf of all geriatricians in Turkey, because I am the representative of this society as the president, GRIP platform is very important for the geriatrician because the geriatricians are interested with almost all the people in the age of 65 and over.
Seasonal influenza is one of the most important diseases which can commonly faced by diabetic people. We would like to increase the influenza awareness and increase the vaccination of diabetic people in Turkey. There are around 6.5 million of people with diabetes, and they are all prone to infectious diseases.
Biz eczane eczacıları olarak bu platformda yer almamızın en büyük avantajı değişik kurumlara ait derneklerle birlikte çalışmak, projeleri oluşturmak ve bu projeleri halk yararına kullanmak amacıyla burada olmak istiyoruz ve buradayız. Amacımız risk grubuna aşının ulaşmasını sağlamak ve risk grubunu bilgilendirmek. Eczanelerimizden risk grubunu bilgilendirmek en büyük amacımız. Daha çok bilgi verirsek daha çok aşı olacağına inanıyoruz.
Shortly after the launch of the network, the GRIP platform organized its first scientific meeting for general practitioners. For the first time, Turkish GPs discuss influenza openly with mutual stakeholders and government officials, detecting underlying miscommunications, creating national targets, and joining efforts to be made in the future.
Dans les pays comme le nôtre, l'union fait la force et donc réunir dans une même plateforme, dans un même cercle, tous les différentes disciplines, c'est très important pour lutter contre les maladies infectieuses.
Close collaboration with the Turkish government is indispensable. The Ministry of Health has been supporting the newborn GRIP platform in the fight against influenza. This way, the government can achieve useful scientific data and cooperate easily with all stakeholders.
As Ministry of Health, we are of course dependent of the social politics and the health politics of the current government. So we are supporting the studies of this platform and we are together with them. We have to be listening, we have to be searching what they think, what they do, and get information from this independent scientific approach.
Another important task is to make sure that the perception of the flu is taken more seriously. An action plan is needed to convince people to protect themselves against influenza and to keep the influenza issue higher on the agenda.
It is important to have a standard, so in this platform, different specialties, all of us working together, that make us to set up true and reliable policies.
We don't have any time to wait. We have to step forward every year more and more to get less and less burden of influenza.
Türkiye'de ilk kez bir grip platformu oluşturuldu. Sağlık Bakanlığı ve birçok uzmanlık derneğinin
With the goals defined, the need for the GRIP Platformu network becomes ever more clear. For the first time in Turkish history, the major national stakeholder groups with an interest in influenza started to communicate together through the network. Not only the risk groups, but the broader population of Turkey will benefit from these joint efforts. Results will be clear in the future because the fight against influenza continues. With the Turkish influenza platform on track, we move to Austria. Austria has an excellent public health system, yet the influenza vaccine uptake in risk groups could be higher, and there are still barriers and misconceptions about the influenza vaccine. Therefore, ESWI has set up an Austrian influenza stakeholders network, bringing together a core group of some 18 Austrian influenza stakeholders.
And the idea is to maximize the effectiveness of influenza prevention and control and to increase vaccine uptake with the aims to meet WHO targets. Austria is a country resistant to influenza control. We have the best recommendations in the world, but the implementation is the name of the game. I mean, the Austrian medical system is very consistent when it comes to influenza control. One could speculate, we don't vaccinate, but we do the therapy. No, we don't do either of them.
The main problem in my country is that people are wrongly informed or not well informed or not informed.
Following the same methodology as in all influenza stakeholder networks, ESWI brings together representatives of national and regional public health authorities, pharmacies, hospital management, the medical scientific world and the military.
Austrian Armed Forces would like to contribute something for the health of the soldiers. Influenza is a serious illness, therefore we make this decision. And we provide all the vaccination for all the military personnel, even for civil servants, for free. So the army covers the cost.
Facilitating the meeting, ESWI launches debates between the stakeholders. For example, the fact that vaccine uptake in Austria is below the European norm.
We have been in influenza for some 15 or more years now, and we have still work to do. We want to identify the local barriers to influenza vaccine uptake and develop an action plan to overcome those barriers. That's why we're here today, to listen to you and listen to each other, where the barriers are to improve the situation and how we can perhaps help to give examples from other countries.
I see two main challenges. The one is the awareness and the knowledge in the public about the disease is not there or not as it should be. And also then the knowledge and the awareness from the doctor's side, because they are really the key transporters of this message to the patients. So where we try to really go down to valid data which are agreed between the ministry, between AGES, between the experts, so that we have a valid and a basis information.
The only possibility to fight this misconception is to help general practitioners to talk to their patients and to try to get vaccination free of cost to some of the population, for example, the elder population. If we try to get the free flu shot, we should improve nearly by 100%. So we would be moving from 10 to 15 to 25 to 30%.
We should bring to the GPs the correct information, a new one, information which is better than the last one. I think that's the most important thing we have to do next year. And so we have to start to grow up together with our patients.
And we are doing quite a lot in vaccinations. And for instance, our biggest subsidiary is in Romania, where we have now around 25,000 employees. And by really going out to the oil fields, to the men there, and we manage around to vaccinate around 10,000 people every year.
Today, one of the main barriers is the fact that people in the risk groups are hardly vaccinated. Also discussed is the fact that healthcare workers could contaminate patients with the influenza virus whenever they're in direct contact with their patients.
Maybe it should be mandatory. We have discussed it.
Mandatory?
Mandatory vaccination should be in social workers, in doctors, in the hospitals.
In your hospital, mandatory vaccination would be something to do?
Bring the vaccine not only to the oil workers, but also to the healthcare workers.
Right.
So get the vaccine on the station where they have the possibility to vaccine just each other, and I'm quite sure that the healthcare worker will get a better vaccine coverage.
Support from the Austrian government for the Influenza Stakeholders Network is indispensable.
The only successful way is to really collaborate and do it together.
Austria has 9 federal counties, and each of them has its own policy on influenza. While vaccine uptake is higher in some counties than others, it could be much better all over. The healthcare authorities in all the different counties therefore need to speak out and communicate with each other and with the other stakeholders in order to reach a more common strategy.
There is a lot of communication between the 9 federal states from Austria in this issue of the flu shot, and on the whole there hasn't been a great improvement as far as the people are concerned who are going to have the flu shot.
With the action plan established for the coming months, the Austrian Influenza Network meeting was a success. Misconceptions and barriers will be tackled according to this plan. The follow-up will rely on the communication between all the stakeholders involved in the network.
The most important point of the action plan we made this afternoon or this day is to influence and to reinvent to the GPs and also to the health worker, and in the second line to the people. This may be an aggressive advertisement.
To get an idea of how well ESWI's country influenza stakeholders network is being applied nationwide, we travel to Finland. To start, ESWI met with representatives of THL, the leading public health authority in Finland. Together, they prepared a list of no less than 20 important influenza stakeholders, with the aim of building up a Finnish influenza stakeholders network. Finland needed a vaccination register and decided to measure the scale of the possible risk groups and to obtain new influenza data from local authorities. A very important part of the program is the fact that hospitals also undertake personal initiatives to vaccinate their personnel. Believe it or not, the thousands of healthcare workers of this hospital in Helsinki are all invited to come for their flu shot free of charge after their lunch. Finnish hospitals are taking seasonal influenza very seriously. The director of this hospital visits the vaccination booth himself, not wanting to miss out on his own yearly flu jab.
As a medical director of this hospital district, I feel that it's a responsibility for our personnel to take this vaccination. Most of doctors and most of our nurses should feel their responsibility that they do this also not for themselves but for the patients.
In Finland, influenza vaccines are merely given by local authority health centres and baby welfare clinics. The seasonal vaccinations are organised by the local authorities and they report the vaccination data to THL.
We are coordinating health stations and guiding the nurses. We have 26 health stations here in Helsinki and then 5 city hospitals. This year, risk groups, of course, they are important group: heart and lung diseases, diabetes, liver, kidney diseases, HIV patients, cancer, and splenectomy patients, for example, they get this vaccination.
What we have seen in this film is actually how ESWI operates today. We have realized as scientists that we cannot do it on our own. So what we need is really the umbrella organizations in Europe. Together, we go into the respective countries. So the way in which ESWI helps to install these national influenza networks is by first going to the national responsible organizations. Consequently, we help the network, we facilitate it, we catalyze it in its activities. So in establishing the network, one of the first goals of the network is to establish an action plan, a national action plan to combat influenza. I think joining efforts, joining force is the best way to tackle influenza towards the policymakers, decision makers, and really also towards the people who suffer from flu the most.
The collective of expert groups, healthcare workers, patient organisations and the government has made a commitment to work on vaccine uptake among the risk groups in Finland. This collaboration within the Influenza Stakeholders Network is exemplary in Europe. It's ESWI's aim to reduce the burden of influenza in all European countries where influenza remains a threat.